Here at Allegheny General Hospital, they see a pretty diverse range of cases. Not only are they exposed to pretty routine community bread and butter cases at our satellite hospitals, but they do see the complex cases that get referred in from other outlying hospitals.
We're a go-to in the hospital for patients that are not doing well across the board. So I've resuscitated with the team patients in the interventional radiology from another service. We've taken care of medicine intensive care patients who are bleeding to death, doing their massive transfusion at the bedside with the medicine team. All our residents are encouraged to be in the operating room as much as possible. So when they're not taking care of patients on the floor, we encourage them to come in, even if they come for part of a procedure.
The culture and the personality of our program is something that I'm very proud of. I feel that the residents and the attendings here have a very tight-knit community and support. I feel like we are all one big happy family, to be honest. I actually trained in this program. The things that I learned and the people that I met is what drew me back to become faculty here.
Our fellows never been over hours. They work for a very specific time during the day, rounding on the patients. They have time for educational endeavors.
We do try and have events available to encourage people to go out and have a life beyond the hospital walls.
When you look at numbers, so you're saying, oh, they did 1,100 cases. Well, is that just padded with 200 to 300 kind of hernias or gallbladders? And they're not. We do all the gamut of surgical oncology. We have all the subspecialties involved. We have the trauma program that's stationed here. And so with that, it brings all patients from all different backgrounds, all sorts of severity of illness.
While the ACGME requires that all graduates have, at the minimum, 850 cases, our graduates tend to graduate with more than 1,000 cases. And I think that speaks to our volume here. The number of cases that one sees and does is what will help them be comfortable operating on their own.